You've got a small cavity. You come in to see your dentist, they see it, they take an x-ray, they confirm, they get you numb, they do a small filling. 20 minutes later, you're out the door, good to go. Now let's fast forward. That filling's been in your mouth 5, 10, 12 years, doing its thing, not causing any problems. Unfortunately, they're not a permanent patch or permanent surface. They're designed to be that way, but the mouth is a harsh environment, undergoes a lot of forces and a lot of changes, and there's no way to guarantee that a filling is gonna last forever. Most people don't know this, but the fillings, whether they're tooth colored or silver even, will actually expand and contract at a microscopic level depending on the temperature and the kind of foods and liquids that you eat. And a lot of times, a new cavity will start to form under or around the edges of where that filling is attached to your tooth structure. So now all of a sudden with that cavity present, you need a bigger filling. And that's the best case scenario, just a bigger filling. Most times when that decay spreads, it gets to the point where there's less healthy tooth structure than the size of the filling, and at that point you have to protect the tooth with a crown. The problem is you might assume that a filling is permanent and stop paying attention and stop taking care of that area of the tooth. You might skip a couple years of checkups, life gets busy, I understand. You might ignore some sensitivity here or there that comes and goes, but then all of a sudden that small filling becomes a big problem. Now let's talk about cracks, because cracks in teeth are prevalent everywhere. Everyone has minor cracks, and sometimes those cracks also grow up into bigger problems. Cracked teeth are tricky to diagnose because they don't always show up on x-rays, and sometimes they're hard to see. Unfortunately, a lot of times the crack doesn't just move on. Every time you chew, that tooth flexes and the crack can get bigger. With that open crack, microscopic bacteria can work their way into that little groove and get closer to the nerve. Once that stimulus reaches the pulp, which is the inside, the main nerve center of the tooth, it can begin to get irritated and inflamed. And now you need a root canal that you didn't necessarily need to have 6 months ago. Here's the frustrating part. Had the crack been diagnosed earlier, the tooth could have been saved from needing a root canal by putting a crown on at that point. If the crack goes down below the gum line, you might not be able to save the tooth. It's the same tooth, but if you catch the problem earlier, you have two completely different outcomes. That window is basically the difference between this is fixable versus the tooth is not savable. And that's exactly how something that seems small and minor ends up becoming a bigger problem that you didn't account for. A lot of times this is what we see in my office, and there's no judgment here because I completely understand the logic. If something hurts, you come see us. The dentist gives you options. You have two options at that point. There's the more thorough, maybe more expensive, involved solution versus something small that you can fix quick and inexpensively. So you choose the quicker option because it's less expensive and you feel like you'll get the immediate relief, which makes total sense. The issue is when that becomes your default answer to any dental problem. When every appointment becomes, let's just put this little fire out versus let's look at the whole big picture and make sure these don't become bigger problems. Short-term fixes aren't bad. Sometimes they are the right solution. They can buy us time and get you out of the immediate pain and work as a bridge to getting towards a more definitive solution. But they have a shelf life and they're not the definitive long-term answer. So if you keep applying short-term fixes beyond their shelf life without a long-term plan, in the long run, it might actually be more expensive than a comprehensive plan that had started from the beginning. We have patients that have spent thousands of dollars every couple years in patchwork and repair fix, when in reality, had they decided to do the definitive restoration, in the long run, they probably would have saved more money. It is an education on the difference between a short-term fix as a plan versus a short-term fix as a default habit. Let's walk through what actual real progression looks like. Let's start with something simple and straightforward, like a cavity between two back teeth. Patient comes in, needs a small to moderate size filling, everything gets restored, the patient's happy, and we just tell them to keep an eye on it. So a few years pass and that area becomes a little bit sensitive and tender, doesn't feel quite right, but the patient decides just to get some sensitive toothpaste to deal with it. But then a crack starts to form or break down around the margins of the filling. And now we start to get into more symptoms: sharp pain on biting, prolonged sensitivity to hot and cold, zingers when you bite down. So the patient finally comes back to see us, and now we've got a crack in the tooth, decay that's reached into the nerve, and in order to save the tooth, we have to do a root canal and a crown. So now, after a few years, we're gonna have to spend a couple $1,000s to address the situation. So now, after the successful root canal and the crown, everything's stabilized, but over time, we might start to get a little bit more bone loss or more breakdown of the tooth structure at the gum line. And eventually, we're talking years or decades down the road, that tooth fails. Now we're looking at extracting the tooth and doing an implant, or extracting the tooth and doing a bridge to replace that missing tooth, which are decisions that will affect the nearby teeth. And at some point in that timeline from small filling to replacement, and it's different in every mouth. I can't tell you when it was along that spectrum. There is a window of time where maybe a different decision, a more proactive decision, might have altered the path of that tooth's history. And it may not necessarily be that first filling. Maybe it was the crown. Maybe it's earlier monitoring. Maybe it's detecting that crack earlier. The point here is that dental problems do have momentum, and once a tooth has an issue, it's only going to grow over time. And we want to be able to handle it earlier rather than later. So the big question is, how do you know when you've crossed from just maintenance into, wow, this is a big battle on our hands? Here's what I would tell my friends. When you've had the same tooth worked on 3 or more times, you need to have a long-term conversation about the longevity of that tooth. We're not saying it needs to be pulled or that it can't survive for a long time, but when it's been that involved and worked on, you need to sit down and look at the longevity of the actual tooth. The second factor to look at is the cost of maintaining that tooth in its current state versus the cost of replacing it. So if you're doing that math with your dentist, you want them to be able to help you look at that over a certain time frame, 10 years, 20 years, and really make an informed decision. The recurrent pain, the recurrent sensitivity, the recurring issues, that's not just bad luck. That's your body and your mouth actually telling you, hey, something's still going on with this tooth. And the most important thing is here, when a situation like this, if you don't have a plan and you're just putting out fires and you're just reacting to stimulus, that's not ideal. I want you to ask your dentist, what's our long-term strategy for my mouth? Not just for this tooth, but where are we headed and how does this tooth fit into the mouth? The whole mouth plan. Teeth are strong. Enamel is the hardest surface in your body. They're not designed to fail. They're designed to last a lifetime. And with a healthy mouth and the right information and the right timing, you can get pretty close to that and maintain them a long time. The decisions that you make and don't make have a compounding effect on your teeth. Good decisions actually compound over time, and that's what I want you to remember. So subscribe if you want more conversations like this where I break things down without all the dental jargon. Leave us a question in the comments if your own mouth has something that's been nagging at you. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.